Now to Health Matters. Today's health segment will discuss about a new 3D mammography machine. Radiologists highlight that the new 3D mammography machine is one of the best tools for diagnosing breast cancer and other breast-related issues, enabling early detection. Dr. Joseph Musabyimana, a radiologist at the University Teaching Hospital of Kigali, CHUK, notes that this new machine has significantly increased the hospital's capacity to examine and diagnose more patients compared to the previous equipment.
So this mammography machine mainly is used to compress the breast. Then we give X-ray, which are generated by this machine. Then with those X-ray, you get an image that is sent into the system. Then experienced radiologists read those images to provide the report. So mainly those images, the main goal of this machine is to detect the cancer region versus non-cancer region, or to rate the patient if there is no abnormal finding in her breast, regardless the pain or the other symptom that they present with. Like this machine, we can do what we call tomosynthesis. Mammography itself, it is when once you take the image, the breast tissue are superposed. It means that the many tissue, they are taken into single image, like 2D. While with this one, if you do 3D, it's like 3D. It's like doing cut into the breast so that small region at 2 millimeter can be seen. So it will help us to detect small region before they become aggressive. After localizing the region, then we do biopsy. So it's a small cut to bring a piece of that region so that can be analyzed into the laboratory to know which type of region. Is it cancer or non-cancer, what we call benign? If we will be able to detect cancer early or via the screening to detect any region that is suspicious to become cancer in the near future, those regions will be removed. In normal routine, the time of exam is almost 10 minutes. Within 10 minutes, exam is done. Then if there is a decision for biopsy, as in next 1 hour, the radiologist provide the report. If there is need of that biopsy, the next step will be to prepare patient so that he can be aware of what is going to be done. So we schedule that biopsy for another day after communicating even with the treating doctor who sent the patient. With this machine, let us refer to a mass or a region which is in the breast. With this machine, a trained radiologist categorize the tumor region that are there into the malignant or into the non-malignant benign region. There is even a percentage probability of this region is malignant or it is not malignant. So with that probability, if the probability of being malignant it is more than 2%, then we start to say if this has the probability of being malignant, then it is a candidate for biopsy to confirm. If it is benign, then there is like some region that, like we say, a cyst, a cystic region. It is those regions which contain the water-like region. So with those regions, no need to do biopsy because we are sure confidence level, which is more than 95%, that it is not cancer. So patient can stay with that region. If it's small, if it causes pain, then it can be removed. If it doesn't cause any other problem, then stay with it. So with this machine, it helps you to categorize so that you can take a decision. Either patient can go home, either patient can be treated different to biopsy, or either can be candidate for biopsy. Mainly for the screening, as the female, the breast cancer is the most prevalent in female than male. Mainly we invite female to do screening even if there is no symptom, even if there is no complaint, no pain in the breast, nothing in the breast. So above 45 years of age, we encourage female to come for screening. After they do the exam, safe breast exam, if there is nothing or if there is something, after 45 years of age, she's candidate to come for screening. So for diagnosis, mainly it is once the treating doctor, the patient consulted for pain or for other reason in the breast. Then if that treating doctor finds there is either region like mass, like if there is unexplained pain, that person is sent to us for exam. So that is what we call the diagnostic mammography. Then we perform exam to look or to add to the treating doctor information. Then for biopsy, after the second one, the diagnosis, if we find that there is some lesion, it is now there is candidate for biopsy. So biopsy can be used, this one, in case of the calcification, because those are friendly lesions for the X-ray.